Hi, I'm Carol Ann.
I'm Bailey.
And I'm Jackie. We are your speech pathology team at UAMS.
Today you're going to learn about feeding your baby in the NICU.
Feeding is a big task we expect premature babies to master while in the NICU. Feeding by mouth is often the last task babies work on before discharge. Feeding your preterm baby is very different from feeding term babies. With breast or bottle feeding, you have to coordinate suck, swallow, and breathe. This is a reflex babies get between 32 and 34 weeks, but it's only emerging. This reflex does not mature until later, closer to 37 to 40 weeks. There are several things you can do to help your baby eat by mouth as they continue to grow. Typically, babies start breast or bottle feeds when they're at least 32 to 34 weeks, on 1 liter of nasal cannula or less, and they start showing readiness cues. Your baby will start to show readiness cues before their feeding times. They need to be in an awake or drowsy state, have a flexed body posture, and show interest in sucking. You will notice them rooting or bringing their hands to their mouth. If mom is interested in breastfeeding, you want to establish this before introducing a bottle. Please let your medical team know that you are interested in attempting breastfeeds. Lactation or nurses can assist with breastfeeding attempts if needed. Some preterm babies will need higher calories than breast milk can offer. This requires fortifying milk that will be provided by a bottle in addition to breastfeeding attempts. Preterm babies can become overstimulated easily, so you want to try to create a positive feeding experience by reducing environmental distractions, bright lights, and loud noises. It's important to focus on your baby and avoid distracted feeding. Babies benefit from being swaddled with their hands close to their face to help keep their bodies organized while they eat. Typically, preterm babies will be fed in an elevated, more sideline position. The infant is placed on their side with their nose and belly button lined up. Their shoulders should be higher than their hips. This position may feel awkward to you at first, but it's a natural position for the baby since it's a similar position for breastfeeding. Side-lying allows the milk to pool in their cheek and let the baby swallow when they are ready. In an upright position or cradle position, the milk goes directly to the back of their throat and the baby has less control over it. There are many benefits to side-lying. Research shows that it reduces the risk of liquid going towards the lungs. Don't worry though, you will not be holding your 9-month-old in side-lying. This is just to assist with feedings here during the early phases of learning to eat. Nipple flow rates are one of the most important considerations for safe and successful bottle feeding. Making the flow rate slower assists with that suck, swallow, breathe coordination. It does not mean the baby is working harder to get the milk out of the nipple. In fact, research proves that slowing the flow rate down often makes it easier for your baby to bottle feed. Typically, your baby will start using a slow flow nipple. If this flow rate appears too fast, your baby may benefit from a speech evaluation. This is when a speech pathologist will assess your baby's oral skills and swallowing safety. We will help find the appropriate nipple and bottle option for your baby. Pacing is a strategy that we use to assist with swallowing safety. It helps with suck, swallow, breathe coordination. It can also help with the overall control of the milk expressed and the endurance to complete the feed. To pace, you can gently tilt the nipple downward, moving the milk from the nipple back into the bottle. Your baby will then pause to breathe. If they continue sucking despite the tilt, remove the nipple from their mouth. You can rest the nipple at their lips and allow them to pause and breathe before presenting the bottle back.
Eyebrow raising.
If your baby is having trouble eating, they will demonstrate stress cues, which can include facial grimacing, pulling away from the nipple, losing liquid from around their mouth, eye blinking, breath holding, squeaking or stridor sound, vital variability, events, finger splaying, watery eyes, wetness, coughing and choking, and eyebrow raising. Breathing fast and hard can also be a sign of stress while eating. When feeding your baby, you want to focus on the quality of the feed versus how much they take. If your baby's feed looks good and safe, eventually the volumes will follow as they mature. Preterm babies are at a higher risk for aspiration or when the liquid goes the wrong way into their lungs. When we aspirate, we feel it and cough and choke. But most babies will not cough, which makes it silent aspiration. There are some things you can look for if your baby sounds wet or gurgly, dropping their heart rate or pulse ox. And if there are concerns for aspiration, a speech pathologist will see your baby frequently and help with your feeding plan. Stop cues are just as important as the readiness cues. You should stop the bottle feed if they have ongoing stress cues, vital variability or events, a fatigue state, poor seal to the nipple, poor midline flexion with their arms at their side, or they are uninterested or asleep. It is okay if they don't take the full volume in the bottle. Remember, they are still practicing and learning how to eat.
Okay, you'll be done. You done?
Breast and bottle feeding can be hard for preterm babies. The focus should be on the quality of the feed over how much they take. Things to avoid when feeding your baby are twisting the bottle, moving the nipple to prod them to continue sucking, undressing the baby to wake them up, or making the nipple faster, or continuing to feed despite those stop cues. Breast or bottle feeding can be a long process, but with patience and careful feeding, together we can get your baby home safely eating.
We hope this helped you feel less intimidated to feed your baby.
And just remember, feeding can be a really slow process, so hang in there.
If you ever need help feeding your baby or want to speak with one of us, your nurses can easily get a hold of us. You can also call the main number for the UAMS NICU. We're happy to help.